Thanks for joining us on the news this hour. Let's begin by telling you that this report contains some disturbing images and viewer discretion is advised. We're staying with the developments in Jigawa State, where the death toll from the devastating tanker explosion on Tuesday has now risen to 166 and 104 hospitalized with severe burns among the survivors. The explosion occurred in Majia town of Tara local government area of Jigawa State. About 50 victims with severe burns are receiving treatment in hospitals in Jigawa and Yobe states. In a visit to the affected area, Secretary to the Government of the Federation, George Akume, conveyed President Tinubu's condolences to the government and families of the victims. He said the president has directed the National Emergency Management Agency to take swift action in providing aid to the affected families. The chairman of the Nigeria Governors Forum, Abdurrahman Abdurrazak, has also sympathized with the victims and pledged support.
We received 34 patients and we lost 2. You can see majority of them have more than 70% burns, which is very critical to manage. So since morning we have been on our feet to see that we do the justice to these patients.
Go around all the hospital where they are,
Meanwhile, the People's Democratic Party has condoled with the families and government of Jigawa State over the tragic petrol tanker explosion that resulted in the death of over 150 Nigerians, with many injured in Majia town, Tara local government area. The PDP calls on the federal government to investigate the remote and immediate cause of the explosion and put measures to ensure safer transportation so as to prevent recurrence. The party commends the efforts and courage of the police, firefighters and other Nigerians who helped to put off the fire and rescued some of the victims. For more updates, I'm joined on the news tonight by the Medical Director, Federal Medical Center Nguru, Yobe State, where some of the victims were taken to. Professor Hadiza Usman, thank you for talking to us tonight. How many of the victims are in FMC Nguru and what's their condition like?
Yeah, thank you very much. Yesterday at around 11:30 a.m., we received a distress call from General Hospital Hadija that we'll be receiving these victims. At the end of the day, we received 34 of these victims in our center. As of the time, in the last 1 hour, we've lost 6 of them. Currently, we are left with 38 of them. Like you heard from my emergency team on ground, most of the cases, unfortunately, are to some extent a bit not too good, with almost 75% burn, and some of these burns are second-degree burns. For those of us that are in medical practice, we know the effect of this burn in terms of management. Most of them are male, all of them are male in the age range of 20 to 50. And unfortunately, we have 3 children. We just lost a child out of these victims. And we've been trying to make this easy for them since their arrival yesterday. My team has been on ground, offering all the necessary services to rescue and make sure that the remaining victims survived.
Correct me if I'm wrong with the figures, Professor Usman. You received 34 injured victims. You lost 6, leaving you with 28 survivors, right?
Yes, 28 currently on our admission.
Would you say that the Federal Medical Center has the capacity to see to the welfare of the remaining victims?
Management of burns internationally is not an easy task, but as we speak, we have a lot of the experts on ground. We have specialists in that area. We have our general surgeons, we have plastic surgeons, we have experts, both nurses and doctors, and all the other requisite healthcare needs to take care of them. But like I did mention, that management of burns, especially with the type of burns that we received yesterday, is not an easy task even internationally. But my center is doing its best to make sure that we give the necessary services to these victims, and we hope that we'll be able to rescue most of them at the end of the day.
What kind of help is the hospital soliciting from government and well-wishers?
Really, it was quite taxing yesterday when they came, but we put everything in place to make sure that the emergency needs are provided. The state government, I think I would like to use this opportunity to thank the state governor, the Jigawa state governor, for coming to our aid immediately. He made a pledge to take care of their immediate medical needs. But we know that managing burns is not easy. It's not just about the immediate needs for now. A lot of them will end up with possibly long-term complications that we need to continue to manage. As we speak now, we cannot say categorically how much we are going to spend on them, but managing burns is quite expensive, and we are calling on all well-wishers to come to the aid of these victims. But as a center, our first priority is to manage emergencies, and we'll try able to do that since yesterday, managing them even before the pledges start flowing into the hospital. And as we speak, none of them lacked the basic emergency that we need for them. Some of them have been taken to the theater. Those that need to be in the ICU are already in the ICU and have been catered for. And all my staff have been on ground since yesterday, trying to see that we're able to rescue more lives from this inferno.
It sounds like you're saying that the cost for the current care has been taken care of by government, right?
It will be taken care of. There was a pledge by the governor yesterday, but that did not deter us from going ahead to provide the service that we need, that the patient needs, and we're doing that.
Professor Hadiza Usman.
We hope that more of that will come, and the governor will actually take care of their needs at the end of the day.
We're counting on that. We're counting on that as well. Prof. Usman is the Medical Director of Federal Medical Center Nguru. Thank you for the good work we're doing, and we wish you Godspeed.
Thank you very much. Thank you very much.